Oh. Hey, everybody. Well, this is a great pleasure because Sheena is my dad's grad student from 100 years ago. And I've invited her on to show you her technique of dealing with trauma. And we'll get down to that in a minute, but we're just letting people in and we'll have a casual conversation about how's life. What's up?
Great.
You've been doing your work for some time, haven't you?
Yes. Look forward to sharing with you.
Yeah. Well, here comes a cat into the blurry background. You're going to sit on my knee for this. We could do cat trauma.
There was one physician was wondering if she could use it for her dog with acupuncture points under the dog's ear. And so I asked Dr. Assis, the gentleman who developed this technique, and he gave her some tips.
Amazing.
Mm-hmm.
Well, yeah, I mean, I think so many things work. I actually had some animal upset, basically because I have two of a litter that my friend downstairs, Adea, has two of the litter. And so they were originally a whole family, lived together very well until the boy cat of Adea's became kind of he's top cat, right? And he started to become the top cat of the neighborhood and slightly gangster cat. And so he's always terrorized these guys. And my cat, my female, who was just with me, who's his sister, her response to that was to start eat fur off her stomach. And apparently it's like a cat sign of stress. It's a bit like biting your nails and everything. And there were all these interactions. And then he passed away 2 years ago. And then everything is now resettling, and it's sad for Adea, but it's also like for these cats, sudden freedom. But there was a certain point when he'd run my third cat out of the hood.
Mm.
And this summer, when he disappeared like for 12 years, like
wow.
He came in at night and he would come in for the winter, but all the summer season he was like just a few gardens down, but out of the hood of Gangster Cat. And I was traveling in Sweden, and this woman said to me, do you want to have the most amazing animal healing session with this woman? She doesn't speak English, she speaks Swedish, but she does speak cat. And I was like, let's do it. And she altered the behavior. It was amazing. Even on the first day, I could see the difference of just these cats mellowing out, not being so stressed out.
Wow.
So there's so many things you can do. But yes, the cat healer, the Swedish cat healer who couldn't speak English but can speak cat, and does it through photographs, does it from afar. Yeah. And it worked. So there's so many weird and wonderful ways to heal.
Oh, yeah. You know? Oh, yeah.
And maybe what I could do is spotlight you, and you could talk about this way, because I found it.
Now I have a number of slides that I can kind of go through, and I'll share those. And then I'll give you different experiences. You guys can ask me questions. You'll know a little bit more about what I'm doing and don't do. And then we can go from there. Does that work?
Perfect. I've just made you co-host, so you should be able to share.
Okay, let's do that. Okay. Yes. Is that good? Mm-hmm. So this presentation, it's a combination of slides from both Dr. Daniel Assis and myself. I'm the director of the Electrosensitive Society, and I learned this method of treating psychological trauma at the International Light Workshop in Croatia in 2019. And Dr. Assis is a physician who specializes in anesthesiology and pain management. And he practices acupuncture, auriculotherapy, auricular chromotherapy, and psychotherapies focused on trauma. So a little bit about what I do, and then a little bit about the trauma. So electrohypersensitivity, what is it? It's an environmentally induced disability. And years ago, it was referred to as neurasthenia, a weakening of the nervous system. It's also referred to as radio wave illness, microwave illness, screen dermatitis, or electromagnetic sensitivity. Idiopathic environmental intolerances is what the WHO referred to it as in 2004. And one of my colleagues, Dr. Magda Havas, refers to it as rapid aging syndrome. So this is a list of symptoms common with those with EHS. And it's been shown in the scientific literature that electrosmog, or electromagnetic fields and frequencies, impairs your immune system function. So I think that's why there's so many symptoms. It depends on each individual's ability to have their immune system function properly. And the ones in orange are some of the most common symptoms. And some people have one or two symptoms, and other people have the whole slew of symptoms. What we found is that there's 5 common precursors in people that have EHS. So there's number 1, physical trauma to the central nervous system, such as whiplash or concussion. Chemical exposure, for example, to amalgam fillings, metals, drugs, even tattoos. Electrical exposure through shocks, if they've survived electrocution or lightning strikes, or really have a really intense exposure to a cell tower or Wi-Fi or a mobile phone use. Biological trauma, so if people have experienced exposure to mold or have a high parasite load or they have Lyme disease. And then the 5th precursor is an impaired immune system. So I'm asked regularly if people can recover from EHS. The acronym that Dr. Havas and I have created is called R²ID³. The first R stands for reducing your electromagnetic exposure, and the second R stands for resetting your limbic system. So I'll describe in detail what I mean by these first 2 R's. So that's really what I help people with. So a lot of people who are electrosensitive, I realized that they really needed that limbic reset. And that's why I was so interested in learning how to do this auricular chromotherapy for trauma, because it's that first step in resetting the limbic system. I represents boosting the immune system, and D stands for detox, DNA analysis, and dental. And you really need the help of a good healthcare provider for the ID³. So many people with EHS complain of heart palpitations. In this video, it demonstrates Dr. Havas, where she demonstrates the variability in heart rate with exposure to wireless technology. This upregulating of the sympathetic system, an analogy she likes to make is that you push the gas pedal of the car. This has been documented in her peer-reviewed publications. And for more information, you can visit her website, magdahavas.com.
Well, 16 by 9 wanted to test the power of Wi-Fi, so we went to visit environmental scientist Magda Havas from Trent University to do another test. Professor Havas's subject, Martin, who calls himself electrically sensitive, is hooked up to a heart monitor, and Havas sets up a wireless computer.
Well, what we're going to be doing is we're going to be taking Martin and exposing him to microwave radiation from Wi-Fi, the same type of thing that we have in schools, for example, and just monitoring his heart to see if his heart reacts to any of the radiation. He won't know when things are turned on or off, so it's going to be a blind study in that regard.
With the Wi-Fi plugged in, Martin's heart rate accelerates in mere moments.
Now I can feel something. It's going through my chest. I feel it down in my legs too.
The closer the router is, the greater his reaction.
A few seconds ago, it was like my chest was actually jumping in the middle here.
Then, seconds after the wireless internet is unplugged, just like that, his heart rate slows down.
Martin, how are you feeling right now?
Fine, I don't think there's anything on.
But listen to this. Those levels Martin was exposed to, well, they're acceptable according to Safety Code 6. So if they're safe, why was his heart racing? Magda Havas has a theory.
So some percentage of the population is reacting to these microwave radiation at levels well below Safety Code 6.
But I'm not sick from Wi-Fi and I use it all the time.
Well, not everyone has the same sensitivities. We have children who have peanut allergies. We have people who are allergic to pollen. They react to pollen. And it's same with electrical sensitivity. Only a percentage of the population react.
So in order to reduce your electromagnetic exposure, you must first measure it. And using the following meters, you can determine what should be eliminated in your home or your clinic. Assistance can be provided by a trained professional, such as one from the Building Biology Institute. So you want to measure radio frequency radiation, dirty electricity, electric and magnetic fields, and light noise, and blocking out the blue light. So radio frequency radiation, it's invisible. We can't see it, hear it, only some of us can feel it. If we could hear the radio frequency radiation, this is what the various emitting devices would sound like. So this is a Bluetooth. A baby monitor, a Wi-Fi router, cordless telephone, a cell phone, and a mother's baby monitor. So some homes would literally sound like this. You get the idea. I won't torture you anymore. So these are pictures of devices that many of you have in your home. And I want you to be aware that they all radiate just like those demonstrated in the previous slide. So it's really critical to eliminate these from your living spaces, particularly your bedroom where you sleep, and focus on the control to reduce your exposure that you do have control over within your homes. And you can have more tips to electromagnetic hygiene from my website, electrosensitivesociety.com. So what happens is people get into flight or fight physiologically from the wireless technology. So that's why I put this piece in at the beginning of my auricular chromotherapy training sessions, because sometimes people could get stuck in flight or fight from a physiological perspective. So you need to reduce your electromagnetic exposure. And then this limbic system reset is so much more powerful. So you want to shift from a sympathetic, where your nervous system prepares for flight or fight, to a parasympathetic, where your body rests, digests, and restores. So before you're able to reset the limbic system, you must treat the psychological trauma. And so you can experience trauma from directly experiencing the event, witnessing in person the event occurring to others, or learning about a traumatic event happening to a close family member or friend. So all of these can be traumatic. Where is trauma stored? It's stored in the limbic system, which is made up of the hippocampus, the amygdala, and the hypothalamus. So they regulate autonomic responses in our bodies. And there's both immediate reactions of shock and denial and long-term reactions. So that's, again, what Dr. Assis found, is that there were these multiple physical symptoms that were directly related to the trauma. So according to Dr. Assis, the impact on trauma and stress on the brain is that it splits them into two hemispheres and prevents information exchange between these two hemispheres. And the left hemisphere is solutions directed and not sensitive to negative memories, while the right hemisphere stores the trauma and is very sensitive to negative memories. So there are a number of therapies that are used for integration and restoration of this communication between the two hemispheres of the brain. And there's so many modalities that help do this. And the one that I'm going to present on today is auricular chromotherapy. So this is the website for Dr. Daniel Assis and his method of auricular chromotherapy for psychological trauma treatment. And he's published his technique in the journal Medical Acupuncture. And with this study, the authors demonstrate a 93% success for this type of treatment. So what exactly is it? The lobe of the ear represents the central nervous system and limbic zone. I'd like to draw your attention to the point 1 on the ear, which is located the point associated with the amygdala, and 2 is the hypothalamus. And that little line there with the 4 on it, that's the psychic scar. So certain points on the ear lobe are sensitive when palpated while remembering a significant event or trauma. This technique is non-invasive and does not require the client to share any details during the session. So you ask them to remember the worst moment, and that activates that point on the ear. You find out which ear is more sensitive, the right ear or the left ear. And then while they're thinking about that trauma, you shine a small LED light on that most sensitive part. And by doing this, the victims are literally able to eliminate their trauma. So I'll talk a little bit more about exactly what happens and how that works. And for more information, you can see Dr. Assis's website, assisdelore.com.ar. So this is a short little video where Dr. Assis demonstrates his method on a woman who's just lost her father to a heart attack.
Bueno, fíjate, gírame la cabeza ahí. ¿Duele?
Ujú.
¿Duele?
Sí.
¿Acá?
No.
¿Acá en el borde? ¿Duele?
Sí.
Sí. Ahora gírame de nuevo y fíjate si esto duele más o menos que la otra.
Menos.
Menos. Bien. Tu papá hace hoy una semana que murió.
Ujú.
Bien, cerra los ojos. Gírame un poco la cabeza y busca la imagen más terrible que no te podés sacar, me dijiste. ¿Cuál es la imagen?
La parte que me encontré a mi papá en el baño tirado.
Cuando ves esa imagen en el baño tirado, ¿qué te produce ahora al recordarla?
Un dolor.
De 0 a 10, ¿cuánto es? Ha pasado una semana.
10.
Bien. ¿Dónde lo sentís en el cuerpo? ¿En el pecho? Bien. Vos concentrate en esa imagen, nada más, ¿estamos? Concéntrate en esa imagen, nada más. Bien, respira hondo y fíjate en la imagen.
No lo puedo encontrar.
¿Se borró? ¿Y qué ves en lugar de eso?
Nada, el lugar vacío.
¿Estás más tranquila? Bueno, después me contás. Listo. Bueno, Gisela, ha pasado 8 días. Cerrá los ojos, te pido por favor, y trata de buscar esa imagen que no podía sacarte de la cabeza. ¿Qué ves ahí?
Nada. Está completamente vacío.
Y la angustia y el dolor que tenías,
Se pasó.
¿qué palabras te vienen con respecto a eso que te pasó?
Tenía mucho dolor
¿Y ahora qué te decís?
y ahora estoy más tranquila. Como que la paz entró otra vez a mí y la verdad que me siento re bien porque no lo podía conseguir por el hecho de que pensaba todo el tiempo en eso, pero ahora ya no.
Bueno, gracias.
So Dr. Cease and his colleagues have clearly documented the steps on how to apply this simple yet effective method for treating trauma. And you can see their publication for the step-by-step protocol. This is a little bit about it. It's slightly modified, but you palpate both ears, searching for that tender point, and you ask them to close their eyes and search for that painful image, the worst moment. And then generally, if the trauma is older than 6 months, you'll have the left ear is painful, and the opposite's true if you're left-handed, and it's checked. And then they're asked to describe the emotions and how strong those emotions are from 0 to 10. And then you ask them, like, what do they say to themselves about it? What are those negative words, like, I'll never get over his death type of thing? Then you ask them where they feel it on their body. Often a loss like that she experienced is in your chest. So that's why he asked if you felt it in her chest, and she said yes. And then you search for the most painful points, a little bit higher up or further down. And then it's treated with the yellow light while the patient maintains that scene in their mind. And then you watch them really, really closely for their gestures and their breathing and their general posture. And then, they really do become more relaxed. It's quite obvious. In this example, she had tears running down her face, and then she started to lick her lips and stuff. You could see how she was much more relaxed. Then you ask them to breathe deeply. And then after a couple of minutes, you ask them what happened to that image, and it tends to fade or completely disappear. And then once again, you ask them for that emotional feeling on a scale of 0 to 10, and it's often 0 or 2. If it's not really, really low, you can do a treatment again. And then you ask them, now, what do they say to themselves about it, that they can overcome their death? And again, you can do it on the other side or on the other ear or other painful points if it's not 0 to 2. And then if is that physical sensation still, that tightening in the chest, you would shine the blue light in the ear's concha. And I'll have Dr. Cease describe that a little bit more in detail in this next video.
The representation of the limbic system is in the ears lobe.
Yep.
The amygdala, hippocampus, and hypothalamus, or always the cortex cingulate, it's here in the lobe. This region of the ear is innervated by the nerves that becomes from the central nervous system. In the concavity of the concha of the ear, I repeat, we have an innervation from the vagus nerve. And then in the limbic system, we put yellow light. And after the treatment, sometimes the patient say, I have some sensation. You have to ask to the patient, yes, I have some sensation here in the chest, in the stomach. Then you put the blue light 1-2 minutes on the concha of the ear. Then with these 2 lights, blue and yellow light, you have the device to begin.
So again, it's the yellow light is specific.
Yellow light.
The trauma system, and then the blue light are for the physical sensations, the more physical body sensations.
Yes. Yep. Maybe sometimes I have patient that that comes to the cabinet saying, I have an anguish, I am fear here, only sensation, you don't have image. Then sometimes I put the blue light and the anguish is gone.
Really? So what I was really amazed with is his success in psychological trauma treatment in children. And for children, it's slightly different than the example I've shown you with an adult. Instead of asking them to scale their emotions 0 to 10 and doing that way, you ask them to draw a picture. So this is an example of an 11-year-old girl, and her father and grandmother had died a few months prior. And she suffered from obesity, depression, and suicidal thoughts. And she was on antidepressive medication. So this was her picture that she drew of her loss, with the feeling of her loss of her father. And after her 3-minute treatment, just once, after a 3-minute treatment, this is her picture. So you notice it's gone from black and white to color and connection. This is her with her grandmother before that 1 3-minute treatment. And this is after. This is again her grandmother before, black and white, and after. Just the connection, the color, it's just amazing. I was actually in tears when I first saw his work with kids because I was so moved by it. And 1 month later, the same 11-year-old girl had lost weight, no more suicidal thoughts, and her medication was reduced by 50%. So really game-changingly effective in everyone, but particularly with these kids. So again, just to summarize, yellow is for the trauma treatment on the earlobe, blue is for treatment of the physical sensation in the concha, and green, it's put on the tragus, and that's for balance. So literally, he has a demonstration of a blind man that the glasses were on, and even though he was blind, he was seeing out through the glasses, and they were green, and it corrected his balance. So green is incredibly good for balance. So I've shone the light on a person's ear as green, and the tragus, that little part that sticks out, and they had surgery, so their shoulder was higher than the other, and even though they'd had that surgical intervention, it still straightened them out as to balance it out as well. So these are the lights that people have used. The little keychain lights I recommend, they're literally 93 cents for the light. You can use lasers, you can use very, very sophisticated lights. But these little LED lights that I have a little link on my website to them, they are $11 in the US, but I found them as cheap as 93 cents. So as long as it's that color of yellow is for the trauma treatment. And then again, if you know of anybody who's electrosensitive and needs a little bit of help and guidance, I've been successful at helping people who are electrosensitive be accommodated and have them provide access in hospitals. I've had 8 hospitals here in Ontario and doctors' clinics and dental offices, eliminate their Wi-Fi exposure, turn off all their mobile devices so that people can come and access their medical help. So happy to answer any questions that you might have.
Well, I'll unmute. That's just amazing seeing it like that, because we've talked about it. If you get rid of the background.
I'm trying to find you.
Find where we are.
I am. I know. Hilarious.
It's like, where are we?
I know. Where'd you go?
I think we might be behind all of that.
Yeah, I think so too. Really great how you're seeing my, you can stop my share too.
Yeah, just stop the screen.
That would be great.
Yeah.
We'll have to do a little editing on that part.
Oh, I never, ever edit.
Oh, perfect. I'll help you with that part. That's so cute.
It is what it is, But Alora said amazing in the middle of that. So I'll add her to the pin and you can have a chat with her.
Great.
Yeah. Yeah, that was incredible. Well, like most people, pretty much everyone, I don't think many people escape trauma in their life, but I have trauma. But I work with women. I facilitate creative writing classes for women to work on trauma. So a lot of that comes up in memoir writing, and I find at least half of the time, 50% of the time, when women are writing on memoir stories and looking back on their childhood, there's trauma, and often sexual trauma. So this is just so fascinating to me for my my own trauma, but, clients that I work with, and also, friends and family. And I was also thinking of my dog, because in the summer I had to put my other dog to sleep, and they were twins.
Mm-hmm.
And she's grieving, that my
Mm-hmm.
dog here,
Mm-hmm.
she's grieving and depressed and has anxiety.
Mm-hmm.
And then I was going through super anxiety and depression as well this year, until a couple of months ago. So I was also interested in the, being, sensitive to the EMFs and the Wi-Fi, because I find I was with my friend yesterday, and I was working on my computer, and literally after 2 hours, I was exhausted. I just wanted to go home and lie down and not do anything. I can't do these 6-8 hour days on the computer like I used to. So this is all fascinating, Sheena. So you can literally buy these lights and do it yourself?
You can't do it yourself, but I've trained. So find somebody who will help you. Find a practitioner of any professional can help you by just learning how to do it. I do these free training sessions once a month, just through Zoom, just exactly like we're doing. And they get the lights, and I've walked through the practitioners with exactly how to do it, and they've held the light to the patient over Zoom. There's lots of different options. So that's what I've done. I've trained, really, it's like hundreds of doctors and practitioners now, all around the world. And they are using this to treat literally thousands of their patients. I don't charge for my training. I ask them if they wanted to give a donation to the Electrosensitive Society, because I help people that become sensitive. And some of them, like, just imagine being sensitive to something the whole world is addicted to. It's a bit of a lonely journey. And often, because they can't be accommodated, they end up not being able to work. They sometimes have to leave their homes. They become homeless. So I help them in all sorts of different ways, with information, with getting a doctor, with getting remediation specialists in to help them reduce their exposure, all that kind of stuff. So when I first started doing it, I have this one doctor. He kept on giving me $100 every month because he couldn't believe all of these patients that he could never do anything for. All of a sudden, he was able to help them, and they were getting their lives back. And they were getting, because trauma, as you probably know, it's really tricky to get at. And the nice thing with this is you don't really have to do a lot of talking. Like, the therapist doesn't even need to know what the trauma is. All they need to know is what if you have an image. Some people don't have an image, that's okay. And what's the feeling? What's the feeling associated with the trauma? And that's what you treat. So one example that I have is this woman had a car accident, and they were rolling the car, and 10 out of 10 of fear, because they had that visual of them passing away, dying. And in their visual, she said that it was like a black screen just came down, and it was just gone. And the fear, she was in tears of fear, 10 out of 10, down to 0. Went home and then contacted the practitioner again, saying, can we do that again? And do you need to know what the trauma is? No, you don't need to know what the trauma is. So came back, had the treatment again, and just was able to eliminate the trauma without ever even having to talk about it or even say what it was. So particularly, those people that have been dissociating it for so long, like they don't even want to deal with it. So not having to speak about it, particularly those like 18 to 25-year-olds, or just a very, very difficult trauma. It just doesn't retrain the brain to hang on to it. It literally does the opposite.
Amazing. I'm just thinking, the person who popped into my head was my friend's ex-husband. Apparently, he was fine, as a husband, as a person, etc. And then he got sent to the Middle East when one of the wars, I think it was the war in Kuwait. And then, he came back with all the PTSD. And, they ended up divorcing because of, it seems like, well, the trauma, but he disassociates and all of that. And even now, he's still suffering. So this is just incredible. Like, the whole world needs to know about it.
Yeah, that's how I felt too. That's why I do what I'm doing, because I originally presented at the EMF Medical Conference in 2021. I did a webinar for those physicians, and I agree. The whole world needs to hear about it, because it's so effective, so simple, so accessible, and so effective. And it doesn't come back. Like, it's not like you have to then keep doing it. And there's an interesting example that we had. This little guy. Can you see that? No,
because it's in your. Oh, there we go. Oh, almost. Yeah.
I know. Okay.
Yeah.
So this little guy, he had his little sister was stuck in a bathroom, and they couldn't get the door open. And so it was a really traumatic situation, particularly for the parents. So this little guy was 4. And all of a sudden, he was just really, really traumatized by it. So it was scary. And then they got the door open and it was fine. But then he started to manifest all of it and was afraid to go into rooms, afraid to go into public washrooms, afraid to go in the car. Like, it just started to really, really impact their lives. So he drew about it. And then he said, "How do you spell sad?" And so he wrote "sad" next to it. And then they shone the light on his ear, both ears, for just a few minutes. And then he was asked, "How do you feel now?" And he goes, "I feel happy." And he drew a heart.
Oh.
And colored it in.
Great.
Oh.
So like, it's like, you can't, like, he would have no idea what they were doing. It's really remarkably powerful and a really beautiful practice. So anyone that that does any type of trauma treatment in any shape, way, or form, send them to the electrosensitivesociety.com, and I'll put them on my monthly free training.
That's great, because I noticed that when you were, now I'm going to add myself. When you were talking, you were saying it's therapists, and I was wondering, here, I've got one of them here. You gave me these. Why therapists, or why not the ordinary person? Is that because you're protecting your medical? Is it a way of, protecting something?
I think when you're dealing with trauma, it's traumatic. It's not something to play with. It's not something to experiment with. And so if you are really comfortable and know about how to do that and walk into it and whatever, then you're probably quite qualified. But if you're just going to, because when you're dealing with not only your trauma, but somebody else's trauma, I think that there has to be a little bit of awareness and sensitivity and professionalism, for lack of a better word. So if you're a therapist, you're already dealing with people that are in traumatic situations. And so you have all of that. Like, it's interesting when I start to train people, a lot of people have said, there's a lot of stuff that you don't necessarily, it's not just hold the light. It's not just this. And so when you have a professional that's used to doing that, trauma informed, you take care of all that other stuff, because there's a lot of other stuff.
Yeah. Okay.
So like it's, I'm laughing, like, trauma's traumatic. No kidding. So like, it's just, and you would never want to, it's, you get what I'm talking about, I think.
No, I totally do. I just wondered what that distinction was that you're making there. And it's good to know what you mean, because I probably don't see therapists as much as I see healers. And I would imagine healers have the same ability to, to handle the whole of the person and the whole of the experience when they come in.
Exactly. And that's why, like, I don't vet. I don't vet anybody. I'm like,
Yeah.
oh no, like what's your credentials? But again, just having that. Yeah. Cause those healers, like you say, they get it.
Well, the only experience I've had, which is similar, and I've mentioned this to you as well, is I had NLP for a severe needle phobia. And the NLP experience, because they're doing eye movements, etc., neuro-linguistic programming, I hadn't got a clue what it was, but I had a 20-minute experience after being a severe, like horrific fear of needles, to the point where you couldn't peel me off a railing if I could get hold of it, you know. And my parents talk about this, trying to pry me off a railing to get me in to have an injection. So as an adult, when I knew I was going to have things like blood tests, etc., the thought of the blood test for 3 weeks at least before the experience would send me crazy. I had all of that. And the NLP was a similar bizarre thing. It was nothing to do with why did I have this? What did I experience with it? None of those questions were asked. I was just asked to visually see what happens as I go in a room. The doctor's standing there with the blood equipment or whatever, you know, palpitations and all of that. And then there'd be the moment of the actual having to visualize the actual moment of the needle going in, which would make me go hysterical. And then afterwards, and how I walked out of the room. And they just had this going back and forth, like walking backwards, coming back to the middle of the scene. And we shorten each moment on each side of this. It's like a cropping a film until the only thing you see right at the center is the thing, the needle jammed in my arm, and then it fades to white. And then he just said, and you're cured. And I went, oh, come on. Like, I mean, it was like, you got to be kidding me, doing this thing. And I was, I mean, it was just remarkable. So I can now watch the injections and the whole, have the conversation with people, whereas before it would be like days and days of anxiety. Now I don't like it. I mean, I don't know if anyone does, but I'm not completely neutral, but I am absolutely neutral in my behavior around it. So
amazing.
It's a bit like that, you know, you can't explain it, but you never have to go into the why of it. It's just gone.
And those parts of the brain are associated with the emotional centers and the memory centers. Right. So again, it has that impact on the memory as well as the emotions associated with it.
So it's like deleting, like they said, he used that word. And I can imagine just deleting these things out of your life, how healthy you would be if you're not just hanging on to. There's a cloying energy of looking back at past traumas as well, where it's like, oh, I want to be in that again. I feel it in the whole. And if you just erase that, it's amazing. Clean slate.
The really neat part too is I've seen people who were literally living their trauma every day through anxious thinking or whatever. They had the trauma treatment and then they were literally a different person. But the really interesting thing is, they had forgotten that they even had the trauma treatment done.
Oh, wow.
So it's so gone.
Yeah.
That it's not even like it's gone. Yeah. So they don't even remember, like they don't dwell on having it or that it was, you know, and you'll say, you know, remember that trauma treatment? They're like, oh yeah, I forgot about that. When it was like their every single moment of every single day.
Yeah.
So it's like, it's shocking.
Yeah.
Yeah.
It is.
So incredible. I do have to apologize. I have a client in 2 minutes. Okay. So I'm going to watch, and she's just joined the Zoom, and I'm going to watch this, and it's been amazing. Sorry, I couldn't be here for the whole time.
It's a pleasure. I mean, I think we can wrap up as well, because people will contact you. I'll put your details up of how to connect with you. See you, Alora. It's great to have you here. You know, people can connect with you and follow it up. And actually, are you able to do it through Zoom to people?
Absolutely. Yeah. I get them to get the lights, and then they have the person that's going to help them, the person they trust, that practitioner, to hold the light.
Oh, great. And you would talk them through that.
Show them how to do it.
So go Sheena and get in touch with Sheena and connect with her, because this is just simply amazing. And thank you. It's been such a pleasure, seeing so much more about it. I've had it done.
Thanks, Inara. Thank you so much. It's been a pleasure.
Yeah, I know. It's so great. Well, let me end the recording and stay there for a minute. And I will say goodbye to everybody.